Hi, I'm Dr. Christine Kannler. I'm here today to talk to you about skin cancer and to perform a skin cancer screening. My brother was Peter Kannler. He was a firefighter in Chelsea. He was a teacher at the Mass Academy for Fire Services. My brother Peter died of esophageal cancer at the age of 37. And so I'm here to talk to you all because I did a lot of research the year that he was diagnosed. And so I learned a lot of things that I'd like to share. So number one, when we first found out that Peter was sick, I scoured all of the medical literature. And so the first piece of literature that I found was that Massachusetts was the first state to look at cause of death for firefighters, and they looked at the cancer registry data, and they looked at firefighters versus police versus all other occupation, and that's where they found that firefighters had the increased risk of cancer and multiple types of cancer, including melanoma. The issue with this study is that it was a small population, and so in medical studies we need a lot of people to have a lot of power to show statistical significance. There are many other small studies across the world. And really what was the most powerful study was the 2014 NIOSH study. They looked at 30,000 American firefighters distributed between California, Chicago, and Philadelphia. And that study showed that firefighters were 9% more likely to get cancer and 14% more likely to die of cancer. This study did not look at skin cancer. The Nordic study, which was also done in 2014, which was 45 years of data, the NIOSH study was collaborated by the 2014 Nordic study in that they both showed that cancer was elevated in firefighters. So the Nordic study showed that cancer was elevated in firefighters, but more importantly that melanoma and prostate cancer were found in firefighters in the age ranges of 30 to 49. Now that's a really big difference because the typical patient that develops a melanoma in the United States is a 65-year-old white Caucasian gentleman. And so the fact that they were seeing melanoma in firefighters at the age of 30 was a big deal. The same thing holds for prostate cancer. Now one might argue that the patients or the firefighters in the Nordic countries look a little bit different skin type-wise than Americans or American firefighters, but the fact was so significant and so astounding that that's why I'm here today to look at your skin for melanoma. As we look at your skin, I'm going to also talk to you about a few things. Some things that I feel are important and I wish my brother had. Number one, this is a free app that you all can download on your phone. Whenever you go to a fire, you can record your own information. You can record the date of the fire, the location, whether it's a house fire, a kitchen fire, a car fire, an industrial fire. You can also record anything that's weird about the fire. If you know the chemical that's burning, you can record that. If there was green smoke, you can record that. God forbid you get sick 10 years from now, 20 years from now, you don't have to go through all that paperwork. This is your data, no one else sees it. If when the calls come through to your station, if it goes through the N4s, it should automatically load into this, so that's even less data that you have to enter. And you could do it in the engine on the way back to the station. This is a no-brainer. The other thing that I wanted to talk to you about is the Firefighter Cancer Support Network. God forbid, I hope you never get sick, but should you get sick, this is a great support network for you. But even if before cancer is found, this is a great educational foundation for you because they teach a lot about cancer in the fire service and what you can do to lower your risk of developing occupational cancer. Here are 11 things that you can do to lower your risk. Because you're here today, I want to also teach you about this form here. This is the form that you should be giving to your primary care once a year. It's the firefighter physical form. And this is a form with multiple recommendations that should be of medical tests that should be checked for you. These are the doctors that have done all the research. There's one primary care, which is Dr. Michael Hamrock from Boston. All the others are occupational health doctors, which is part of my challenge, is to get the word out to primary care doctors. But in here, this nice graphic here discusses your job as a firefighter and how your job is truly you are a tactical athlete. You're running into fires, which are hot. You're carrying heavy equipment, hoses, and people or whatnot. You're knocking down walls. And so when you're in the fire, your heart rate's going, you're breathing, your lungs, you're breathing smoky environments. If it's a car fire, you could be exposed to bloodborne illnesses. The situations that you folks are exposed to are also traumatic. So basically this handout here talks about cardiac, lungs, cancer, mental health resources, all the way down to musculoskeletal issues and infectious disease. In going over the fact that you guys are tactical athletes, I think it's important to point out that when you are in a fire, your heart, you're running around, your endorphins are going, you're sweating. And so I just want to walk through that with you, because there's things that are happening that are exposing you or making you're running into these environments full of chemicals. You're breathing them in. And so the worst fire for you guys to go to is actually a kitchen fire. A Teflon pan emits so many chemicals into the air that if you're not wearing your scuba without the U, and PFAS is in the Teflon, and so you're breathing it in. So it's going into your lungs, but it's also, we're all eating air. And so air goes into our esophagus, into our stomach, and then into our colon. The other thing that's happening is that the soot's getting on your skin. So when your pores are dilated, you're absorbing more than you usually do. So not only is your pore absorbing more, your blood vessel is dilated because you're running around, but that offers a pathway from the skin for these carcinogens to get right into your blood. So this sounds scary, but is it really true, or is this a really nice story that I've come up with, right? It is actually true. When we look at the blood and urine of firefighters, both before a fire and then after a fire, it turns out that the dioxin level, which is a carcinogen in the blood, goes from none to elevated after a fire. The same thing happens with polyaromatic hydrocarbons. Those are found in the urine of firefighters after fighting a fire, and the levels are increased by 3 to 5 times. So when you think about bladder cancer in firefighters, and you know that it's this chemical, this PAH, is in your urine, and it's hanging around there until your body, urinate it out, it's not a big stretch to say that these chemicals that you're exposed to are elevating your risk for cancer. So the goal is to teach you how to minimize your risk. So no matter, these fires that you go to, you really want to protect the air that you're breathing in. You want to wipe that soot right off your skin. And then the other thing I just want to point out is after you go to a big fire, you smell like a fire for 3 days. After you go to that delicious Italian dinner where they're using a ton of garlic, you smell like garlic for couple days. And so your body is just doing what it's naturally supposed to. It's just trying to get rid of the garlic compound. It's just trying to get rid of those carcinogens. So we know it, but hopefully I've put it together in a way that it makes sense to stress to you the importance of taking care of yourself, because your community needs you, your family needs you, and so we want you to be safe. Because you're here today, this qualifies you for one of the eligibility check boxes for the state CT low-dose lung scan. So basically, this is a picture. That's all this is. It's a picture from about your thyroid to the top of your stomach. When the grant was made, we had to think about what was the best way to screen as many body parts as possible with a fixed cost. And when we thought about it, we thought, okay, well, what can't a firefighter get with their natural insurance? And so this lung CT, you wouldn't be able to get. So basically, it's a photograph of your thyroid, your breathing tubes, your lungs, your esophagus, the top of your stomach, and then it's also your mediastinum, your lymph nodes for like a lymphoma. You're going to go in, you get it, and then if they find something, then your own insurance will kick in. So that was the other reason why we chose this lung CT. And then if you need a workup, it will be covered under your insurance. If they don't find anything, which is what we're hoping, go back in 3 years and get another photograph. So then what we do is we look at this photograph, we look at that photograph. If everything is the same, fantastic, come back in another 3 years. And hopefully the grant is still going. The goal is to get these cancers when they're still small. And if we know that you guys are getting, and girls are getting cancer, the goal is to screen you all early with ways that are painless. And so that way we can get these cancers when they're still small. For instance, a melanoma, if we find it in a stage 0 or stage 1, your cure rate is like 95 to 99% 10 years later. So that's a no-brainer. The other thing that this cancer screening grant allows for is PSA levels. So that goes back to the Nordic study. We want to get PSA levels. I would get them starting at 30, since that's what the Nordic study said. We're adding in mammograms for the female firefighters. Since this was like a cancer screening grant, we couldn't add in the cardiac calcium store. You'll be in the scanner for about 5 or 10 more minutes. Unfortunately, you have to pay $100 of your own money. But if you have a silent widowmaker that's there, we can find it and get you stents. So finally, we're going to talk about skin cancer. 1 in 5 of us are going to get skin cancer. And that has nothing to do with firefighting. It has to do with the fact that we're living longer, there's less ozone, we like to play outside. So basically when we talk about skin cancer, there's 3 types. There's the melanoma, which is in the middle of the form. And so basically the ABCDs for melanoma are: A is for asymmetry, so it's not a mirror image up and down, you can't flip it over or side to side. B is for borders. You want your borders of your freckles or your moles to be exact. You don't want them to be fuzzy or scalloped. C is for color. You want each freckle to be one color, and ideally you want all the freckles on your body to be the same color, or pretty much have a friend of the same color. If you have one freckle that's much different than everybody else, then that's the one that you're going to want to get looked at. D is diameter. The bigger a spot is, the more chance of something the bigger the chance is, the more risk of something changing. So that's kind of makes sense. So we're going to screen you for A through D today, and then basically I might take a photo of a freckle and say, hey, you should watch this, because the last category is E for evolving. And if you have a freckle that is evolving over time or changing, and you have it on your cell phone and you see that it's changing because you're having either yourself or a family member monitor it, then that's great to bring into your physician, because those photos are date stamped, and it should make the physician's job very easy. This other category are the other types of skin cancers. Basically, there's the pre-cancer, which is an actinic keratosis. And the best way that I like to explain this is when you feel your skin, it should feel nice and soft and smooth. If you feel your skin and it feels rough, like fine-grade sandpaper, moisturize it for a week or 2. And if it goes away, fine, it was just dry skin. If it doesn't go away, it could be the start of a squamous cell, or it could be psoriasis, or it could be eczema, or it could be MRSA. It could be anything. Just get it looked at. If it is a squamous cell, most squamous cells we just remove surgically and life goes on. But that being said, if you have a squamous cell on your lip or your ear, these turn into nasty cancers really quick. And so if I were to teach you anything today is, if a colleague or if you have a cold sore for more than 3 weeks, it is not a cold sore. It could be a squamous cell. The other thing is that rough spots or boo-boos on the ear that don't heal after 3 weeks could be a squamous cell. The deal is squamous cells on the lip and on the ear spread or metastasize to the inside of the body, and they can go to the liver, the brain, the lungs, and we don't know why. So if you see your colleague with something funky on his lip or her lip, bring it up with them. And then finally, the last one we have is the basal cell. B for basal cell, B for best. If you had to have a skin cancer, this is the one you want. They grow really slow. They look like a zit. Zits don't last more than 2 or 3 months. Sometimes they go and come in the same spot. The other thing very common is, oh, I hit my head on the car and now it's not healing, or I keep cutting myself shaving. At this point in your shaving career, you're not going to continue to cut yourself in the same spot on your face unless you're using a machete. Like, I don't know what you're using, but just that little pressure on that spot is what makes the cancer break open and bleed. Has nothing to do with the razor. It's kind of like, oh, I just banged my head on the car and now it won't heal. So today you'll have the option of a full skin exam. You can leave your underwear on. You can have above the waist exam, or you can show a spot. But the most important thing is to get in the habit of looking at your skin and making sure that there's no boo-boos that don't heal, and see a dermatologist.